Welcome back. Joining me now is Dr. Christian Miliotto from Western New York Pain Relief and Integrative Wellness Center. Hi, Dr. Miliotto. Thanks for joining me.
Absolutely.
Tell us about Western New York Pain Relief and all that you guys do there.
Yeah, so our clinic is an office that specializes in using what is called research and evidence-based medicine. What that simply means is we are dealing with the body in terms of joint and nerve dysfunction, pain, people that have already had surgery, that are looking for long-term pain relief, reduction in medications, injections, and future surgeries. And we customize our care to the individual that we're working with to help them achieve quality of life and functional improvement.
Why is it so important and part of your mission to avoid those surgeries, injections, and medications?
The reason why it's so important is these are disorders that people have that they're managing with the use of medication and injections. There are people who try alternative therapies. They'll do physical therapy, chiropractic adjustments, massage or acupuncture. 75 to 80% of people will show some relief with that. Some will maintain long-term benefits, some won't. Those who don't are the ones that I want to work with. So we want to help people that have spinal stenosis, disc herniations, multiple neck or back surgeries, or they're looking to avoid their first surgery, and a condition called neuropathy, where people are experiencing numbness, burning, and tingling, weakness or heaviness in the hands, legs, or feet. Those are the individuals we want to work with, and we can get them long-term relief very quickly.
We're seeing it now, but do you want to explain some of the treatments that you have to offer?
Yeah, so we have a three-phase treatment that I developed. Basically, when people have nerve or joint disorders, it can start from the neck or back, affect that nerve root by the internal level, so the disc, the arthritis, the stenosis that you have. That's why people start to notice the symptoms in their hands or feet. They feel they can't sit, stand, or walk, or even lay down for too long, or the symptoms wake them up at night. The second therapy that you see is a machine that we use to work on damaged nerves and muscles. So somebody might come in with weakness, they have numbness or burning in their feet, and we can actually stimulate that nerve to eliminate the pain that they're feeling, and this is something that helps to re-educate that nerve. And then we utilize two very advanced class 4 medical lasers which work on inflammation and circulation. So if somebody has spinal inflammation, a disc herniation, we can actually heal that. Where with surgery can work for some people, but the problem is if you have a disc herniation, for example, you only have 6 months to heal that on your own. And if the disc or the hole that it came out of doesn't heal, you'll end up back in for a second procedure.
Mm-hmm. You just touched on it, but do you want to talk more about some of the negative side effects of those injections or those surgeries and medical procedures?
Yeah, so I could give you a couple examples. I've got a couple new patients I'm working with right now. One gentleman's a really nice guy. He had a surgery about 6 months ago. It wasn't successful, came into my clinic to treat with me. So he comes in one day for a decompression therapy, and he says, you know, my relative's a neurosurgeon and recommended that I get an epidural in my back, so he did. And I was concerned because he had multiple disc herniations. So I told him, I said, you know, call me in the next 7 days if you notice something doesn't go right, because there are a lot of serious side effects with that type of injection. And obviously he trusts his family member. So he called me 2 weeks ago on Saturday. He couldn't stand or walk. And that's one of the side effects. The epidural with the multiple discs wasn't placed in the right area, and now he's actually looking to see what he can do because he can't even get into his truck. With pain medications, you know, it can give you temporary relief, but the big thing is about addiction and long-term use. None of us want to be on a medication that's altering our thought process or how we act, or, you know, many of my patients are on gabapentin, for example. Gabapentin is an anti-seizure medication. It's being given to people for nerve and joint pain as well as depressants. If the doctor told you that that was an antidepressant or an anti-seizure medication and not something for pain, the person wouldn't take it, you know, and that's a very common thing in my office. We help to just rehab the tissue. So we're actually helping to create a level of healing that many people don't expect to obtain. And one of the things I always hear is, you know, if it sounds too good to be true, it is. And, you know, a lot of people think that. I'm the type of person that works off of respect and working with the individual. So I never push people to do care. I make sure I'm a good fit for them. And we have a 95% success rate with people. So, you know, these people are getting long-term pain relief, and it's lasting for years.
Do you want to talk about one of those success stories? Because this is life-changing work that you're doing.
Yeah, so last time I was here, I had Sal. Okay, everybody kind of met him. 7 back surgeries, opioid addiction, numbness, burning, tingling, back, legs, feet, 12 weeks of care, he's 95% pain-free, and he came in and told his story himself. On constant levels, I get emails. Like I was on a different show about a month and a half ago. I had a patient email me, and he goes, you know, after I treated you, now he's had 2 back surgeries. He goes, I've played 49 games of frisbee golf or frolf since I've seen you, and I just wanted to say thank you. These are people who were at a really bad point when I met them. They were debilitated, and they were at a point where they were looking into another surgery, and we were able to help them. I also focus on, you know, the demographic that I treat. They're older. I don't choose to work on them, but that's when these things bother us. Some people are in their 50s or even their 30s, and many of my patients are 75 to 90, where they're managing things and they really want quality of life and function. They want to go to the grocery store, they want to walk, and that's what we're helping people do.
You have seminars coming up for anyone that might have questions or want to learn more in detail about all that you do.
Yeah, we do an educational lunch and learn seminar. This is an opportunity for people to come in and communicate and learn about the things that we're on, why things you've tried in the past aren't successful, and then we talk about what we could do to benefit people. My sole purpose to having the seminar is to be a patient advocate. I want people to understand what their bodies are going through and why they're suffering, because a lot of people feel lost. And then if I have the opportunity to work with people, we get them feeling better.
When is the next one happening?
So I have one coming up in a couple weeks. That is completely booked. The next one is the 3rd Wednesday of May. You guys can call us at 716-650-PAIN. You can go to buffalopainrelief.com, take our pain questionnaire, take a look at our testimonials or people that have actually gone through clinical success with us, and then come on in and come for a free consultation if you want to.
Dr. Miliota, thank you so much for coming in. And viewers, like he said, for more information on all of the services they have to offer, visit their website at buffalopainrelief.com or call the number you see right there on your screen. Thanks again for coming in, Doctor.
Thank you for having me.